Okay, so here we are back with Ivy. And for this part of the procedure, we're going to go ahead and discontinue the continuous IV. And yeah, we're going to start there. So I'm going to wash my hands really good. I'm going to make sure I've checked my doctor's order, my MAR, make sure I have an order to discontinue the continuous IV or saline that's running. And so I do have a doctor's order here. It says that I can saline lock the IV after I've given 2 liters of my 0.9% normal saline. So we've done that, and I'm going to go ahead and disconnect. So I'm going to explain to Ivy what we're doing, and I'm going to have her identify herself. I'm going to cross-reference that with her med record and her wristband. And then I'm going to go ahead and get started. So Ivy, we're going to go ahead and take down your saline. And so for this, I'm going to start really by just, turning this off, making sure this is clamped. Turn the flow off. Turn off the flow. So that's all clamped. And then I can come up here and I can take off this tape. Sometimes it's really hard to get off because it's really sticky. And so you can use some alcohol if you need to kind of help get that sticky off. And you can, once you make sure all that is shut off, you can unhook it. There you go. You want to make sure that if you're going to be using this again, you cap it. In this case, we're not, so we're just going to go ahead and discard. Good double check for yourself is just to make sure that you're in the right spot for that. In this case, it would be empty, so I'm going to go ahead and discard. It sounds to me like the doctor also, oh, I need to flush it. Make sure that we're good here. So I'm going to go ahead and wash my hands really good. I can put some gloves on. Better be safe than sorry. I'm going to clean my port. I have normal saline here. And I'm going to go ahead and flush. I want to make sure that I still have good patency. My patient isn't experiencing any irritation. There's no redness or swelling at the IV site. And in this case, we are good. Whoa, we're good to go. So after I finish flushing, I'm gonna wipe that off again. Really good, so it's ready to go for the next time. From here,
why are you leaving it in my arm?
Well, let me tell you, I would want to make sure to educate my patient on why we are gonna go ahead and leave that in. Mainly it's just for access if we need to use it again to administer any medications or more fluids. Better to save your hand and not have to try to poke you again. We just don't want to take it out prematurely. So it's there mainly just for access. Yeah, so in this case, I'm glad we left it in because the doctor would like us to give her some Dilaudid. So again, with all these procedures, you're going to want to make sure that you're doing all things based off the 6 patient rates. Right dose, right time, right route, right drug, of course, and then right documentation. So she's still in some pain from coughing, and so the doctor has ordered, here it says 1 to 2 milligrams IV push every 2 hours is needed for complaint of pain related to coughing. That order doesn't make me super comfortable. I would like to get some clarification on that dosing because it's just not very clear, the 1 to 2 milligrams. So I'm going to go ahead and call the physician and get some clarification on that dose. He has, after I called him, instructed me just to do the 1 milligram, and I would want to assess her pain probably before I called the physician so that I could give him an accurate report on her pain and he could direct me accordingly. So in this case, he wants to do 1 milligram IV push every 2 hours is needed, and then obviously we would want to, after we did administer that, we would want to go back and follow up with her pain level to make sure that it was going down after and the medication was effective. So with Dilaudid, on the label, here's my Dilaudid, it states that we need to dilute it with 2 milliliters. Every milligram needs to be diluted with 2 milliliters. So I was able to do that, and so in this case, since he wants us to give 1 milligram, I will be administering 2 milliliters through her saline locked IV. Before I do anything, I'm going to identify the patient in two ways. Ask her for her identifier, cross-reference that with her medication record or the MAR, and I'm going to wash my hands, let her know that I'm here with some pain meds for her, and then we can go ahead and get started. So, I'm going to go ahead and get my medication drawn up. Okay. I can safety my needle and go ahead and discard that. I'm going to wash my hands and put some gloves on. I'm going to grab a flush here. Okay, so I want to make sure that my port is clean. I'm going to flush with 5 milliliters, but our hand is getting a little soggy, so I'm not going to do all of that. Okay, so flush, and then go ahead and this needs to be infused over 2 to 3 minutes. Well, 2 minutes for 1 milligram. So we're gonna slow down time a little bit here for the sake of the video and for you not to have to sit there for 2 minutes. Sorry. I'm gonna pretend that 2 minutes have gone by and I'm pushing this really slow. Otherwise, it can get really uncomfortable for the patient and give them a nice little head rush. So that was 2 minutes, making sure you go really slow. And then once that, I'm gonna flush again. Again, I'm not gonna do the whole 5 because we're creating a flood. So after I'm done with that, I'm gonna wipe that off again. And So for in this instance, you would definitely want to make sure that you're following up with the patient to make sure that the medication was effective. But also you want to make sure that you don't have any redness, swelling, or irritation at the IV site, pain on their part. Sometimes these medications can be a little bit uncomfortable, but lasting pain is bad. And look for any signs of infiltration. In this case, we are good, and the IV is still good and patent. So we're gonna go ahead and ask her if she has any questions. In this case, we're gonna discontinue the IV. That's our next order from the doctor. After we document all of the stuff from the last procedure, we're gonna move on to this next one. Next order for this patient is to DC her saline locked IV. So, I'm gonna leave, I'm gonna come back, new procedure. I'm gonna identify my patient, make sure that I'm still using my 3-check method and I verify the doctor's order. Same with the medication administration. So I'm going to identify my patient, make sure I have the correct order. I'm going to wash my hands really good and explain to her that she is good to go. She's graduated from her saline lock IV, so we can go ahead and get it out. I'm going to glove up and I can go ahead and start with the removing the tape. Really sticky. And because it can be uncomfortable, I do want to make sure that I'm using alcohol if it gets too sticky. Oh my goodness, this is sticky. So bad to me. Okay, that was kind of a disaster. That's what you don't want to happen. So, I'm just sticking to everything. I'm going to use some alcohol, maybe.